I'm Trish Gleason with the World Wellness Show, and today we have with us Dr. Paul Finucan of Naples, Florida, and he's going to talk to you about stem cells and how they can help you in life. Hi, Dr. Finucan. How are you today?
Hi, Trish. Thanks for having me today.
Well, we're happy to have you. We're excited to learn more about stem cells, the newest discoveries, in fact. So what I'd like to do is have you introduce yourself, and please don't be so modest. Tell us about all your famous movie star clients and how you're helping
well,
them. And
well,
then I've got
I've
some
been
questions for you.
okay. Well, I've been practicing over 41 years, naturopathic, chiropractic, acupuncture, all types of therapies. The main part of our practice is clinical nutrition and sports medicine and regenerative medicine. So we have a wellness center in Naples for any and all health concerns.
Okay. And did you have a television show, or were you on television on a regular
Yeah,
basis? It seems
we've
like
been on television and radio, and we've had people flying from around the world, a lot of professional athletes and some movie stars and top people. We just like to help anyone and everyone, but we do see a lot of people flying that want good performance or better sports recovery, or to help them recover from injury so they can keep being champions.
Okay, great. Well, even though this is an educational program, I want everybody to know how vast your medical empire is down there. You have three clinics. Sounded pretty good. You have three clinics. Can you tell us about the three different clinics there in Naples, Florida?
Well, basically, our primary facility, Alternative Health and Healing and Advanced Regenerative Medicine, is in Naples, Florida, and we have medical center, regenerative medicine, chiropractic and sports medicine, and physical therapy and nutrition. Then we have a spa that has skincare, all organic skincare and facials and massage therapy. And then we have a fitness and wellness and weight loss center. They're all within the same plaza in Naples, Florida.
Okay, well, thank you for that. And I have been there, and I can give you testimony that it is amazing. So let's get into the meats and potatoes of what we're going to talk about today. So here's one of the questions one of my viewers wrote in and had. It was, how are stem cells different than your regular stem cells in your body?
Well, stem cells are a unique cell. We all start out with that, where we are a stem cell with half the code or genetics from our mother and father. The difference in a stem cell and any other cell in our body is stem cells can become two new stem cells, replicate themselves, or they can become any other cell that the body needs. So in the case of a knee, we did my knee with stem cell, tendon, ligament, bone, cartilage, and so forth, anti-inflammatory, anti-aging. So stem cells can become anything your body instructs them to be, a new liver cell or a kidney cell or a skin cell, whatever. So stem cells are omnipotent and can replicate themselves or become anything else that our body instructs.
So you're saying that they can help us live longer?
Well, stem cells are constantly in repair and anti-inflammatory and anti-aging. They often call it regenerative medicine because you are regenerating and repairing the body. And in a newborn, there's 1 in 10,000 cells as a stem cell. In a 60-year-old, it's 1 in 2 million. So as we get older, there's fewer and fewer. They're older and less powerful.
Mm-hmm. So are there any recent new discoveries about stem cell? Because I think it's been around how many years?
Well, it's been around. I met physicians 40 years ago that were already using stem cells, but there's been a lot of advancements, and it's really only been developed very much so in the U.S. about 8 or 9 years. I flew in a world-renowned expert 4 years ago to help us launch the best program in the country and in Florida in our office. And then we added advanced therapies that make our stem cell program more advanced and a better response. But basically, there's something called exosomes. Exosomes are found within stem cells, but stem cells are an actual cell. So for example, when we put millions of stem cells in my knee, they're going to stay in my knee and repair my knee and keep working often for 6 months to a year. But exosomes, those powerful nutrients and signaling molecules, that are inside stem cells, those are extracted, and exosomes can be given in a belly shot and circulate throughout the body and stimulate repair and activate nutrition and repair. And for example, if I have exosomes circulating, they're signaling molecules. So I have a shoulder injury. As they go there, they tell the body, hey, bring all your stem cells and healing over here. So exosomes are something else we use in regenerative medicine, and sometimes in conjunction with stem cells, or PRP, where we spin our blood down and add nutrition and the stem cell or exosome to a joint or to a problem. But exosomes are one of the more recent things, and there's constant research and breakthroughs in every type of treatment with regenerative medicine, stem cell, exosome, and PRP, which is platelet-rich plasma. But for example, I had a older doctor in his 70s and his wife. They said, we did stem cells, they didn't help. I said, where did they get them? They said, they spun down our blood. Well, in a newborn, there's lots of stem cells. In a 70-year-old, there's not. So to spin down your blood and try to get a lot of stem cells to help you is not very effective. So we find what's most effective for the patient. Young people, PRP might be much more valuable. As we get older, we need more stem cell and exosome as a treatment protocol.
So since older people often don't have enough stem cells,
right, they're older and there's not many.
Can you get somebody else's?
Well, what the best quality of stem cells, and what's only legal in the United States, we use stem cells from Wharton's jelly. So our laboratory finds an optimally healthy mom, and the mom and baby go home, and they immediately harvest those stem cells from the umbilical cord. It's called Wharton's jelly. So Wharton's jelly is the best source of stem cell and exosome. And we use one of the top labs throughout the world, and they don't use preservatives, and they get these high quality stem cells. So we haven't had anything but success. And people, if they say they had a reaction to preservatives. Our company and our lab, but we don't use that product. So we use an amazing, clean, wonderful product.
So that is where they're still going to spin the blood, and you're just putting
No. We actually, our lab sends us overnight on dry ice the stem cells in a vial that we put into the body, into your knee, hip, or joint, or wherever there's a problem. And those are from Wharton's jelly. So our lab went to the hospital at the time of the baby's birth, got the umbilical cord, and that's brought to our lab. And then those stem cells are brought fresh to us to use with our patients.
Unbelievable. So you're saying I could come into your office today or whenever my appointment is, and you can give me a shot in my belly.
Yes, that would be
those exosomes.
Yes, and that will.
Or my other option would be these, the ones you just told us about. How do you inject those?
Well, stem cells we can put in a problem area like your joints, knee, hip. We do sports injuries all the time, and a lot of athletes say, "Well, I'm young." Well, if they can't compete because they have injury, we can help them. For example, when we put those in my knee had more stem cells in that location than a brand new baby. So my knee can repair and heal faster than a newborn. But so even young people in athletics or in sports or that are injured use stem cell. Exosome are 1/10,000th the size of a cell, and they circulate throughout the body. So if you put that in a belly shot or in a joint, they're going to feed that joint and help. For example, if you were going to plant a seed out in the garden, you would want rich soil. Well, if we have lots of nutrition and exosome in the joint, put in stem cell, those stem cells all need nourishment. The more nourishment they have, the better the stem cell does. So we do therapies, we do exosome, we do other modalities that increase the success of the stem cell or exosome treatments.
Okay. So you need therapy to help the stem cells grow.
Well, it can make it more effective. So we can do acoustic wave or laser, other therapies that make the stem cell more effective, bring more blood supply, more nutrition to the area, so you can get a quicker, better response.
So like red light therapy, would that help the stem cells?
Red light is a good therapy. And we use, that's one of the therapies, laser and acoustic wave, lots of nice therapies that we can use with the regenerative medicine.
Wow. It's just all about awareness, because what you're talking about can help so many people in the world. Yeah, so let's talk about reversal. So let's say if somebody has an ailment, a bad ailment, dementia or whatever, can you talk to us about in many different illnesses that it can help?
Well, we've seen improvement in many conditions. Actually, there's very seldom we don't see improvement in many conditions. And what my expert said, which I've done now for 4 years, he said, if you're thinking of a condition, whatever it might be, arthritis or asthma, whatever it might be, Google that or do a computer search for that disorder and then put plus stem cell. and you could put dementia plus stem cell or exosome, and you'll see thousands of articles and research and documentation on how those are helping. We've had patients where we just took the exosome and put it in a little sinus spray, and it helped stimulate the brain and helped everything, because people, you can apply exosomes and they can stimulate wounds. We've treated diabetic ulcers and wounds and so forth. So those are powerful ways to help the body heal and repair in a natural way.
Okay. Do those exosomes or stem cells come in the form of patches?
Well, there are nutrients that can help the body with stem cells, and there's some technology that they say can help the body stimulate stem cells, but we found they're not nearly as powerful as putting millions of stem cells into a problem, or exosomes on a problem or into the body. So yes, there are ways to stimulate the body's production with nutrients and other modalities, but the best way is to actually give the body more stem cells.
The injections. Okay. Talk about longevity, because I have been shocked that the closer you get to being old, the more you're worried about having longer life.
Sure. Well, we'll give you an example that we see all the time is 3 years ago when I had a knee injury and could barely walk, and instead of surgery, I did stem cell. We had a patient come in and he said, my brain and my energy, I feel like I'm 45, but I'm 70 and I can barely walk. And they said, I need a hip replacement. So we put stem cells into the hip, and now he's rollerblading again. Well, he said, can exosomes and stem cells help my energy and healing throughout the body? And of course, like I said, they can help heal and repair and anti-age and stimulate the body. So we've given patients many exosome in the belly shot, and they said, wow, everything is healing and repairing, and it's activating my healing mechanisms, it's activating my stem cells and so forth. So there's a lot of ways with clinical nutrition, with the therapies, with regenerative medicine, that we can help most any condition, and the body can actually anti-age and repair.
So you can reverse your age. So chronological, that's your actual age.
Right. They say your biological age is how your body responds on medical tests and maybe how you feel. So yeah, somebody, maybe they are 70, but they feel like they're 50 because they've done a lot of great nutrition and therapy and things like exosome and stem cell. So they feel great. Regrew hair. They do it for cosmetics. People want new skin and new hair and everything to be younger. And we've seen some amazing things in regenerative medicine helping to anti-age and repair the body, repair the skin, repair wounds, so forth.
Okay, great. So is stem cell, that therapy that we're talking about, considered biohacking?
That term is now being used with certain micronutrients or nutrients to try to help the body turn mechanisms and stimulate healing and repair. I wouldn't convey that the same as stem cell or regenerative medicine, but a lot of nutrients can help the body. It's just the stem cells are far more powerful and immediate than trying to get nutrition into the body. And some people, as we're elderly, we don't assimilate our nutrients or utilize it. And so just swallowing supplements may not be effective for all conditions or get nearly as quick of a response.
I hope I didn't hear you call yourself elderly, did I?
No, I'm 66, but I can work 12 hours and go out dancing because of good care. And before I put stem cells in my knee, I could not do that.
Great. Okay. How do people determine if this is something for them to do?
Well, I mean, we invite patients for consultation about any concerns, including regenerative medicine or any health concerns or challenges. And if we're fit for them, and confident we can help them, then we can put together a plan or program specifically for them.
Okay. That's great. And we put Dr. Finucan's information down there, how to reach him. Anybody that's watching, are they able to go ahead and email you with questions, Doctor?
Sure. Yes, they can email us, and I will get to it, promptly. If I'm with patients, it might be the end of the day or certain things, but we'll answer questions, and we'll welcome people for a telemed or to come for consultation. We had people come from Europe recently, from South America, everywhere.
Okay, I have more questions for you, though. You're not leaving yet.
Okay.
So let's go back to conditions, because I have so many people with different conditions. So maybe could you tell us the top maybe 5 or 7 sicknesses or illnesses that you have seen stem cell therapy to be advantageous
Yeah.
to help?
Well, the most common thing we see on a regular basis is injuries, sports injuries, tendons, ligaments, muscles, arthritis, various joint type of injuries or sports injuries. We see those continually, spinal injuries. There's breakthroughs in stem cell where they're regenerating spinal cord injury and damage. We're not injecting the spinal cord. We're not injecting the heart. But around the world, I had 2 patients 20 years ago that were needing a heart transplant. They went out of the country, had stem cells injected their heart, repaired their heart. We're not performing that here. We're doing very safe, very well-known and approved therapies in the United States. But stem cells can do incredible things. What we see on a daily basis is injuries. And then we see people that are run down, or now their other illnesses are improved because of increased nutrition and things like exosome and stem cell. Their arthritis, their diabetes, their various injuries. My wife, it helped with some breathing issues. We've had allergy issues, so many types of conditions. But again, if you want to know about a specific condition you might have, just put in a search engine that condition and then put plus stem cell or plus exosome, and you will see so many medical research on that specific condition. And then we can answer your questions personally for you, what you're battling or what you need help with.
Great answers. Okay, so let's talk about, I've learned through interviewing so many of you amazing doctors that the brain and the gut have a connection. Can we talk about your brain gut, and do stem cells fit in with that?
Well, I mean, like I said, stem cells are helping every part of the body. Your gut, if you have bacteria, you have parasites, you have viruses, that affects your gut, and your gut affects your immune system, every part of the body. So your digestive system is critical. We work with that. We wouldn't only treat that with stem cell or exosome. We would do clinical nutrition. We do healthy diet. So there's many venues that we use. We use many healing modalities. Basically, the most advanced modalities, my passion for 41 years is to help people with any health concern. My second is to research the latest treatments that have 90% of the patients or more respond favorably. And they're safe, they're effective, and that's my criteria to bring a therapy into our facility. Is it has to help 9 out of 10 people or better, or we're not interested in bringing it on board.
Okay. Hormones. I happen to know that you're one of the world's leading hormone experts.
Well,
You're
I mean,
considered one of them.
our hormones, again, we do things like bioidentical in our medical center, but a lot of times giving the right nutrients, you can do precursors and vitamins and nutrients that can help the body balance its endocrine and hormonal system, the adrenal, the thyroid. We see patients with thyroid imbalance all the time. And so we have a lot of different ways with clinical nutrition. Clinical nutrition is nutritional programs for any type of condition in a natural way. But then sometimes, for example, if a woman had a complete hysterectomy, she may need bioidentical hormones, and they may be given in a patch or in a pill or in a cream or in a pellet. And our facility can do that when it's required.
So stem cells don't have much to do with hormones, or they do?
Stem cells, like I said, can become 2 new stem cells or replicate in any other cell that your body instructs them to repair or rebuild. So there's not, again, if you looked up thyroid problems, they're going to be exosome and stem cell that has showed benefit. But we would also give specific nutrients or other therapies and to help those systems. So there's a holistic approach, and we use whatever approach is necessary to get a great result.
So if somebody has questions about hormones, they can email you as
Call
well?
us about any health condition.
Okay.
If we don't have an answer, I'll find one from an expert, but we work with world leading experts, and many of them come for us for care as well.
Great. I knew I was going to squeeze in the questions about hormones because you're so knowledgeable about those. Okay. How do you see the future of stem cell and how it's going to impact medicine?
It's growing all over the world on an ongoing basis. It's helping more and more people. My first question we get constantly, is it covered by insurance? It's been around a long time, but it's not pharmaceutical. It's not surgery. So I don't know when and if it'll be done. It's helping people all the time, but it hasn't been covered by insurance. But it's an incredible, safe way to get well, get younger, get healthier, and repair the body. So it's growing because it's helping people that don't want to have surgery. I didn't want surgery on my knee. I didn't have a choice. It was stem cell or surgery. So I'm happy that I did stem cell 3 years ago. I'm going out dancing tonight.
So it's holistic.
Oh, it's holistic and
Natural.
safe and natural. I didn't have to worry about injuries or problems or complications or the expense of surgery and all those other modalities. And some people say, well, my insurance covers surgery. There's a lot of risks involved.
Yeah.
In medical procedures, there's risk. And with our programs, they're very safe and effective. So I rather do the safest, most effective thing for my body or my patient's or family's body and put surgery and medicine last.
Absolutely. Well, I can't think of any more questions right this moment. Do you have anything you'd like to add, Doctor?
I just welcome anybody with any health concerns to contact us. And like I said, we probably have a healthy, safe answer to help. If we don't, we will research or put them in contact with the right expert. We have physicians come to see us from around the world, and we have a great network of thousands of great doctors and nutritionists and holistic practitioners. And we all want to see our patients be well and stay healthy and young.
Okay. How many doctors are at your location there?
Well, currently we have 4, and we have another top physician we met with this week that would love to join our practice. It happens all the time, but they have to be exceptional to come on board. So we interview, we do our research, and if they would be an integral, exceptional physician to add to our practice. But we do have a whole network of doctors we refer to throughout the country and even in other countries that are good. But a lot of patients say, well, it's worth it to fly to Naples and come and see us because we have an exceptional team here.
Not to mention it's beautiful down there.
Oh, Naples is a beautiful area. I love it.
Yeah. Well, we're thankful for everybody that's watching the program, and we certainly want you to learn the power of holistic medicine and to be proactive about life and wellness rather than reactive. So, Dr. Paul Finucan, we're happy to have you today and interview you, and we will definitely forward the calls to you.
Okay, thank you, Trish, for having me. You have a great weekend, and you got to come and get some stem cells and exosomes. So we're going to keep you vibrant.
I'm
and
coming down soon. I promise.
Awesome. Look forward to seeing you.
Thank you so much. Okay,
right.
Bye-bye. Thank you.
Bye.
Bye-bye.